To begin, assemble all of the medications you will need to begin stimulation. You will need the Lupron or Leuprolide 14-day kit, the Gonal F Multidose kit, and the menopur, an alcohol wipe, and a red biohazard container for your sharps. Prepare this as you would a recipe. Get all of the individual ingredients ready before mixing them together. This way you will avoid mixing errors. First, take the Lupron kit and prepare the dose. You will use the orange cap syringes that come in the kit, as you have been doing, to draw up the dose. Wipe the rubber stopper with an alcohol wipe. And insert the needle through the top. Flip it all over and pull back on the plunger to withdraw the medication. Remember, once you begin stimulation medications, the Lupron dose drops down to 5 units. The top of the plunger must line up with the 5 mark. After this is complete, carefully recover the needle with the cap and set it aside. Put away the Lupron kit. Next, get the Gonal F Multidose ready. In the kit, you will find a vial of powder and a pre-filled syringe. You will start out by reconstituting the Gonal F powder. Flip off the plastic cap and wipe off the rubber stopper with an alcohol wipe. Take the pre-filled syringe and remove the rubber cap. Inject the needle through the rubber stopper and slowly inject all of the fluid into the vial. You do not need to shake it. It will mix right up and you will be able to use this vial for several days' doses. You can then discard the syringe into the red biohazard container. Once it is mixed, you will use the special syringes that also come in the Gonal F kit to draw up your dose. The needle is injected through the rubber stopper and flip it over. Pull down on the plunger to withdraw your medication dose into the syringe. Your nurse would have instructed you with the prescribed dose. It is also written on the mixing instruction sheet that you received in your educational handout. Be sure you draw up the correct amount into the syringe so that the top of the plunger lines up with your dose. Once that is finished, carefully recap the needle and set it aside. Put the Gonal F kit away until you are ready for your next dose. Remember, once the Gonal F is mixed, it should be refrigerated. Now that you have all of the ingredients ready, it is time to assemble the medication mixture. The menopur comes packaged with vials of powder and vials of fluid. You will not use the fluid with this method of mixing. The box of menopur also comes with packages of Q caps. You will not use these either, and they can be discarded. For each dose, you will use 1 vial of the menopur powder. Flip off the plastic cap on the menopur vial and wipe the top with an alcohol wipe. Take the orange cap syringe with the Lupron in it. Remove the needle cap and inject the needle through the top of the rubber stopper on the menopur vial. Slowly inject all of the Lupron into the menopur and remove the needle and discard it in the red biohazard sharps container. Now take the Gonal F syringe and inject the needle through the top of the rubber stopper of the menopur vial. Slowly inject all of the Gonal F into the vial. Instead of removing the needle, flip the entire thing over and pull down on the plunger to withdraw all of the mixed medication right back into the Gonal F syringe. You will need to move the needle down low in the vial to remove as much liquid as possible. Try and get every last drop. Hold the needle upright and check for any air bubbles. If you see any, flick the syringe and the air bubbles will rise to the top. Gently push up the plunger to remove any air. You have been given a graphic in your educational packet that shows the appropriate sites for a subcutaneous injection. Pick your site, wipe it with an alcohol wipe, and gently pinch up the skin. Inject the needle straight in like a dart all the way to the hub. Slowly push down on the plunger. Once you have finished, remove the needle and discard it in the red biohazard container.